So we'll just get started. I appreciate a few more people are coming through, but we might as well get going. So good evening and welcome to tonight's session, Behavioural First Aid for the Veterinary team. So first of all, I'll just quickly introduce myself. I'm Jill McMaster, one of the vets at Protexin. We have a team of about 10 vets at Protexin. We've got various roles, but just to make you aware, we're always here to help out. So if you have any technical inquiries or product inquiries, you'll probably be put in touch with myself or one of my colleagues to help you out. So a quick summary of tonight's session. We're very pleased to have clinical animal behaviourist Rosie Bescoby with us tonight. Rosie's going to talk for about 45, 50 minutes, that kind of ballpark, and then we'll have time for questions at the end. As much as we have time for, we'll go through. You'll notice on the screen, there's a little Q&A button there. So as we go through, you can add your questions as we go, but we'll just go through them all together at the end. So a very quick background on why we're here. Some people get a little bit confused when we talk about Protexin and a calming product in the same sentence because everyone thinks of us as purely gut products. But actually, we have a new product that was launched last year in the UK and has also been going throughout the world in the last little while as well. And that product's called Serenicare, which is the lovely purple that Rosie's showing us here. That's the colour of the box. So Serenicare is alpha-gazozapine, L-tryptophan, fibersol, and also it has a calming postbiotic blend in there as well. So in addition to giving Serenicare, we're very big believers in sort of following the science at Protexin and everything we do. And I think it's widely agreed, in addition to using nutraceuticals or medication, we should really be looking at behavioural modification as well. These medications, and as I say, supplements can be great. We want to support that behaviour as well. But we also appreciate how difficult that can be in practice. That can be very, very challenging. So we at Protexin are really trying to support vets, vet nurses, and other support staff when they're dealing with these cases. So what we've produced is some client behaviour leaflets. We've got some desensitisation leaflets. We've also recently done a podcast starring our in-house behaviourist and also one of our vet team. And also that's why we're doing the session tonight. So we're really just trying to give you that support to help in these challenging cases. Because I know, being a vet myself, I would love a bit more behaviour knowledge, and I think it's a very helpful thing if we can get more info on that. So now I'm going to properly introduce Rosie here. So Rosie Bescoby is a fully qualified clinical animal behaviourist with a degree in zoology and psychology from the University of Bristol and a postgraduate diploma in companion animal behaviour counselling from Southampton University. She is an ASAB certified clinical animal behaviourist, a full member of the Association of Pet Behaviour Counsellors, a member of the Professional Association of Canine Trainers, and is registered as both a clinical animal behaviourist and as an animal training instructor with the Animal Behaviour and Training Council. So I've heard Rosie speak a few times before, and she does some fantastic sessions, some really practical stuff for you. So I'm sure you'll really enjoy this session. So Rosie, over to you.
Thank you very much. And thank you for the intro, because it means I can crack on and not talk about myself, which is the worst part of these talks. So yeah, thanks for going through and introducing who I am. So the format of tonight, we're just going to talk, the first half of the webinar is just going to be a kind of overview of behaviour. And then the second half, we're going to go through 2 case studies of dogs, recent cases of mine, and 2 of cats, just to kind of hopefully piece together the kind of first half, but into a more practical element in terms of case studies. So just to start, obviously, I'm talking to the vet team, so I know there's a whole mixture out there: vets, vet nurses, receptionists, practice managers, all sorts joining tonight or watching this as a recording, which is fantastic. But generally, I think what people think vets do is fix physical problems with animals. But obviously, actually, part of the role, well, emotional welfare is as important as physical welfare. So part of the role should involve identifying when emotional welfare is an issue, being able to advise on that to prevent it at least from getting any worse, and ideally give some advice and tips as well to benefit the emotional welfare, but also to ensure that when we're treating a physical problem, we're not inadvertently creating an emotional problem in the animal by creating a fear of the vets or fear of handling, or anything that can kind of be a byproduct of fixing or preventing physical issues. So we just need to be aware of that when we're treating our animals. Now, some of the emotions, so we know that animals experience emotions. There was a chap called Jack Pansett who only passed away a few years ago, who discovered that he could literally switch on emotions by putting electrodes in different parts of an animal's brain. And he developed 7 processes, emotional processes in the brain, but I've kind of simplified them to the main 3 that we see, the negative emotions that we see. And we tend to lump fear and anxiety in as one category. They are actually slightly different. So anxiety is defined as anticipating a negative event might happen, but you don't know when and you don't know where. Whereas fear is the reaction when you're exposed to a perceived or real threat. So if I use an example here of spiders, so if I'm scared of spiders and somebody comes in with a box with a spider in and says to me, there's a spider in this box, and opens the lid, the emotion that I will feel when presented with that threat will be fear. But if someone came into the room and said to me, my spider's escaped out of my box, it's in this room somewhere, I don't know where, and I don't know when it's going to appear, but it's going to appear at some point while we're in this room, I'm going to be in a negative anticipatory state the whole time sitting in that room. So there's a slight difference there. Arguably, anxiety is a harder emotion. It's normally longer lasting. And because it's less predictable, and there's no strategy to move away from something or try and scare something away from you, it's arguably harder to deal with. And the other emotion that often also is part of a fear and anxiety response is frustration. And again, the definition of this is when we're motivated to access or avoid something, but we're thwarted from doing so. So that might be through physical prevention, like leads. In the case of dogs, we'd be looking at leads or gates or doors or any sort of physical barrier like that. Or it could be a psychological barrier. So an owner saying, don't you dare move, stay there, come back here, something like that. And when we have a fear response, there's also likely to be a frustration response as well. And we'll come on to that when we look at the case studies a bit later. So we know there's loads of research out there now that shows that there's a huge overlap between lots of medical issues and behaviour issues. So whether that's musculoskeletal issues, gastrointestinal, dermatological, canine cognitive dysfunction, sensory deprivation, as hearing loss, sight loss, etc. All of these and more will have an impact on an animal's behaviour. So it's never just a behavioural issue. We know there's increasingly research about the gut-brain link and the importance of the microbiome. Obviously, this is a cyclical issue as well. So we know that when we have a bad tummy, that actually affects emotional well-being. And we also know that when we feel stressed and anxious, it can cause a bad tummy. It's very common for me to see dogs, and I always ask, particularly dog owners, but I also ask cat owners as well, actually, the kind of motions that their animal is showing and the consistencies that they're showing. It's really common with dogs to start off a walk with a solid poo, and as the walk progresses, they might produce several more piles of feces that become sloppier in their consistency each time. And normally that is a sign of either the dog struggling, feeling quite anxious out on their walks, or it could just be that the dog is quite adrenaline fueled on their walks. But either way, their behaviour or their emotions is having an effect on their output, so to speak. Daniel Mills, Lincoln University, a few years back, found that anything between 28 and 82% of their behaviour referral cases had underlying pain. And another study slightly before that showed a very strong link between noise sensitivity and pain. And if you think about that, and if you think about any of these medical issues, I suppose, if an animal or an individual is suffering with something that's making them feel under the weather, at best under the weather, we're going to be far less tolerant to be able to cope with stressors in our lives. And I'll come on to an analogy here in a moment that should help explain this a bit better. But also when it comes to pain and particularly noise sensitivity, we also have this issue where when we react to noise by a startle response, it can trigger, if there's underlying kind of chronic pain, that bodily tension when we startle can trigger a pain response. And we then become, animals in particular start to associate the noises with pain happening. And that then induces this apparent fear of noises. So it's a tolerance issue, but it's also, when it comes to pain, it's also how we respond when we are startled by something. There's also lots of studies that show there's a link in dogs with those that are noise sensitive are also more likely to suffer when they're left home alone. And that might be for two reasons. It might be that they're just less able to cope. That those that are generally quite anxious about noises are just less able to cope with being left home alone. It could be that they have been left home alone and fireworks or loud noises have gone off, and now they associate being left home with potentially scary noises happening. So as I said, pain or illness sensitizes us. It makes us less tolerant, less able to cope. For some dogs, it might be quite hard to examine them and find out whether there are any of these issues underlying the potential behaviour problem. They might be too anxious, they might be harbouring a lot of bodily tension at the vets, they might be fearful of unfamiliar people or vets in particular, and it makes it very difficult for you to do a full examination. It's better in those cases to treat suspected pain or medical issues if appropriate. And this is where supplements can be useful as well, because, you know, if you don't know enough, you haven't examined enough to definitely warrant medication, then trial of supplements can often be useful. But yes, certainly sometimes if you suspect, or through observing the animal moving around, that there may be some musculoskeletal problems there, then a pain relief trial is certainly the first step, potentially whilst referring to a behaviourist. And in certain cases, depending on the problem that's being presented, it might be sensible to run some bloods, or in the case of urinating cats in the home, I would definitely run a urinalysis as a basic starting point. So let's have a look. I think my face, unfortunately, is covering some of the cat photos up there, but let's just have a quick look at what the anxious dog might look like. So dogs will pant when they are physically hot, so when it's warm outside, the ambient temperature, or when they've been doing physical exercise, but they will also pant when they are feeling stressed. And there's a photo here in the middle of a dog showing a typical stress pant, and there is a slight difference just in terms of observing it. But also, as a general rule, I would think, well, if it's not that hot here, which I suppose vet practices often are, but if it's not hot inside and the dog hasn't gone on a long walk to get here, it's likely to be a stress pant. But the stress pant, the tongue will often be hanging quite far out. The corners of the lips will be pulled quite far back. You can often see the back teeth. And most importantly, it will be in combination with other body language signs that indicate anxiety. So this dog here has obviously got his ears pulled right back. Its pupils are dilated. So the whale eye is when we start to see the whites of the eye, and that's basically where the dilated pupils and the facial tension cause the whites of the eye to show, like in the Chihuahua photo there. We might see a front paw raise, like the visual in the middle, again in combination with other body language signs. So her ears are back, you can see her whole weight is pulled backwards away from the camera woman, wasn't me that took it, and the kind of puckered face as well, the facial tension in that one. So that we think the paw raise is please leave me alone, I'm vulnerable, I'm making myself on 3 legs and vulnerable, or I'm getting ready to move away if this isn't working for me. The tail is obviously very expressive in dogs, so tucking it down, they're covering their anal glands, so they're trying to disguise as much scent about themselves as possible, so trying to reduce feelings of vulnerability. It's important here that a wagging tail isn't always a happy dog, so particularly a frantic wag is often a sign of anxiety. And again, I'll say, if you're not sure whether it's a happy wag or not, look at the rest of the body language signs. it will often, a frantic tail wag, go hand in hand with quite frantic behaviour in general, or over the top behaviour. So if you've got a dog that kind of charges into the vet practice and is leaping around and is all over everybody, it's likely to be panting, it's likely to have its ears back, it's likely to be, its whole body going crazy. It could be that it genuinely loves coming into the vets, or it could be that it actually finds the vets quite tricky, because as we know, lots of tricky things happen at the vets, and it's just trying to desperately befriend everyone that it meets. Please be nice to me, please be nice to me, please don't do anything mean to me. And it's a lot of gun dogs in particular are very stereotypical in this. It's kind of their coping strategy. Instead of hiding or using aggression as a strategy, they'll often do this faff about behaviour. So just be aware of that it may not be a dog that is thrilled to be at the vets. And in those instances, whether it is a dog that's thrilled to be at the vets or not, my advice would be try not to match the energy. So it doesn't make it any easier for us to examine a dog that's thrilled to be at the vets and acting daft compared to not loving being at the vets and acting daft. Either way, it makes it quite hard to examine anyway. So just try and make sure everybody keeps calm, everyone from reception onwards just keeps everything nice and calm and as hands-off as possible, so that the dog it hopefully mirrors that a little bit and at least doesn't get more amped up. And the anxious cat. So again, we've got dilated pupils in cats. We've got when their whiskers really protrude and you can see the follicles where the whiskers come out of, as in the photo that you can hopefully see. I can't remember what the photo is that I'm hiding, and I don't know if I can move it. Can I move this? Oh, there we go.
You're not hiding it for us. You're
oh,
okay.
am I not?
No, just what you can see.
Again, just those dilated pupils, the crouched behaviour, the getting ready to move away. For cats in particular, they'll attempt to hide or avoid or jump up high away from something. And again, we'll come on to the relevance of this in the vet practice in a moment. Let's move on. So when we're giving first aid advice to a client that's brought up that they're having issues with their dog or cat when they come in for a vaccine or whatever other reason, the advice we give, the first aid advice, is the minimum we should be giving. And the aim of our first aid advice is to at least to prevent the problem from getting worse, or from anyone or anything getting hurt, whilst you maybe act on a referral to a behaviourist who can go through it all properly and build a behaviour modification programme for that client. So we might need to consider advising equipment, management equipment, such as using a house line in the house if we need to be able to pick up the end of the line and maneuver a dog away from something, if potentially they're not that responsive yet to verbal cues and they don't like hands reaching towards them to get collars perhaps. We will likely need to advise muzzles, and stocking them in the vet practice is my preferred strategy, so that you can show them a little bit of muzzle training. We never just strap a muzzle onto a dog. We always want to teach the dog to put their nose into the muzzle. I've got my email address at the end of this presentation, so if anyone would like a muzzle training handout for their practice, you can put it into your own branding if you like. Just drop me an email. We might need to be recommending baby gates at home. That might be if there's a home where we're introducing a new puppy or a new animal into the home, for dogs and cats to keep separate, or for children to keep separate from dogs or cats as well. We might need to recommend baby gates. Short term, we want to advise owners to avoid situations where the animal displays the unwanted behaviour. And this obviously isn't going to change the behaviour of the animal, but it's at least stopping the animal rehearse the unwanted behaviour, because rehearsal makes the behaviour stronger. Something will be maintaining the behaviour in the first place for the animal to repeatedly be presenting it. So to stop constant reinforcement of the behaviour, the first advice is just stop putting the animal in that situation, work out a way of avoiding situations so the animal doesn't have to display the behaviour. And then again, further down the line, we can start to reintroduce those situations with the behaviourist would support the owner in terms of how to change the animal's behaviour. We want to make sure that the owner's not using any punishment, because that's going to exacerbate stress, exacerbate anxiety. Even if stress and anxiety isn't part of the problem, it's going to add it into the mix, and it's just going to make it a messy mix. So yeah, try and tactfully have that conversation about how do you respond when the animal's doing that, and recommend not doing that. If we need to, as we've already said, trial of pain relief, get them started on some supplements, something that's potentially going to give the animal some support in the meantime. So what's the impact of stress? So stress experienced in any one context will impact the animal well afterwards. This is what we call trigger stacking. So let's use the vet practice as an example. So it might be that you've got a cat that finds coming into the vet's really stressful. That cortisol will remain in that cat system for days, potentially hours at least, or potentially days, depending on the individual, how well they cope with stress, their resilience, and how stressful they found it in the first place. But it's worth bearing that in mind. For some animals, it might be, as long as almost a week, for example. So that means that the animal is going to be less able to cope with any further triggers that might be added on after the vet visit later that day or tomorrow or even the next day. So we might need to advise owners just keep things calm for a period after something stressful happens. If we are not very good, or if owners are not very good at recognizing even when their animal is showing signs of anxiety, the animal will start to think, this is an unsuccessful strategy. So if I try and hide behind the sofa when visitors come round, and either my owner drags me out or the visitors poke their head round the sofa and go, come on, what are you hiding for? Come on out. The animal's going to quite quickly learn that hiding isn't effective at keeping the potential threat away from them. And they're going to learn to escalate their body language. And I've got this ladder here. This is from veterinary behaviourist Kendall Shepherd, created this lovely analogy. We call it the ladder of communication. So it's how a dog or a cat responds when they're feeling stressed or threatened. And if they learn that the rungs at the bottom of the ladder aren't that effective, they will learn to escalate their behaviour up the ladder. And this escalation is driven in part by frustration. So this isn't working. I'm going to have to go up another rung of the ladder until I find something that does work. And by does work, I mean something that's successful at keeping space between them and something they're not keen on being near. And when we think about trigger stacking, I like using an analogy of a sink. And this is from veterinary behaviourist Sarah Heath, her model. So if every individual is a sink, and we all only have so much capacity for coping, and each of us have different volumes of sinks in the first place, and that's based on our genetics and our early life experiences. So some of us have got great big sinks that can cope with loads of water filling it before we overflow, and some of us have got shallow sinks like this picture here, and it doesn't take much for the taps to turn on and for the sink to go into overflow. So we've all got a hot tap and we've all got a cold tap, and we've all got a plug, which is how we drain our sink. And the hot tap is negative arousal. So that might be pain or illness, stress, anxiety, fear. And the cold tap is positive arousal. Human examples would be adrenaline junkie sports like skydiving, going on a roller coaster, going to a rock concert. So things we enjoy, but it makes our adrenaline right up here. And it's not something we can necessarily cope with all the time. So if our sink overflows purely because the hot tap's been turned on too long, there's also a risk of being burnt. So negative emotions, pain and illness also equals potentially being burnt. If the sink overflows purely with cold tap or with a mixture, there's still a chance of a flood, but there's less risk or no risk of being burnt. So what I mean by that is that the cold tap is good in small amounts, but it still contributes. If the tap's turned on very fast or for a very long period of time, there's still going to be a risk of a flood. And then the plug is how we drain our sink. So in dogs, things like, well, in both animals or all animals, appropriate sleep is one way of draining our sink. Appropriate diet is another way of draining our sink. Exercise and fresh air would be another one. The ability to do species specific, ethologically, what's the word I'm looking for? Just behaviours that species needs to do. So in dogs, we've got things like chewing. What else do we have? The shake off. Both animals do that, both cats and dogs, when they have had a bit of either adrenaline or cortisol through their system, they will need to shake it off and fluff all their fur up and get all that tension and adrenaline out of their muscles. So the aim of this sync, when I'm going through this with owners, the aim of this sync is to both reduce how fast the taps get turned on, so reduce the salience of the triggers, and increase the endorphin-based behaviours, so the plug pulling behaviours. And those plug pulling behaviours we've gone on to here. So for both species, repetitive oral behaviour, licking, calms themselves down. It's a little bit like a baby with a dummy. That constant kind of sucking or oral behaviour is very calming. It releases endorphins in the brain. And they will often do this by licking themselves. And this is not the same as a cat having a proper grooming session. A cat, when they're having a proper grooming session, takes a long time to make sure they cover every single patch before they then have a good sleep. What you might notice is straight after something slightly stressful in a cat or slightly frustrating, they will do a very quick and kind of quite ferocious action of licking at themselves. And again, that's them just bringing themselves down after something slightly difficult happened. They'll often, dogs and cats will nibble at themselves, nibble at their fur, and they might lick at us or at surfaces. And again, that can be a sign of gastrointestinal issues, so be aware of that as well for all of these. And licking at themselves can be a sign of a dermatological problem, but just be aware that licking is also a calming behaviour. We've talked about the sleep and the shake off. Stretching as well is kind of releasing that tension out of their muscles. Yawning can be a sign that they are starting to feel a bit anxious, but they can also use it as a self-soothing behaviour, that kind of oral behaviour. Sniffing. So both species, cats and dogs, navigate their worlds through chemical communication, and air scenting or ground scenting or following a scent floods the brain with endorphins in both species. We can use supplements such as the Serenicare, which is obviously the mixture of both the L-tryptophan and the milk protein, but it's also dealing with the gut there through post and prebiotics. Said as well for both species, I personally a real advocate for daily exercise and fresh air, and for most humans too. And to make sure that interactions are positive, we're using lots of reinforcement strategies with both dogs and cats. So we often bound around the term desensitization. What does it actually mean? So if we're working with a dog or a cat that is fearful of something and we know what that trigger is, we can gradually expose them to the thing that they're fearful of, but ensuring they remain relaxed and feel safe at all times. And the latter part of that sentence is really important. It's not just about exposure. It's not a tick sheet of today we do this, tomorrow we'll make it a bit harder, the next day we'll make it a bit harder, the next day we'll make it a bit harder. If we do that, we're not working with the individual, and we're likely to actually be inadvertently inducing a fear, continuing with the fear response. So we only increase exposure if the dog remains relaxed, and it's never a linear process either. So we don't make it harder and harder and harder and harder. Otherwise, the animal quite quickly learns that it's getting harder and harder and harder. So we make sure that there is forward progress, and that we are, exposing the animal to harder and harder increments, but that we throw in lots of easy reps amongst it all. So it's much less predictable, and the animal is getting easy reps and lots of success amongst it. So desensitization causes the animal to go from a negative emotional response to a neutral response. But it's quite easy for that to quickly undo again if they're exposed to something a little trickier than they're ready for. So if we then work on introducing a positive association, we can associate the trigger with something the dog loves. So that might be a special type of food that they're only going to get when they're exposed to the trigger, or a special type of toy. Then we can work on actually changing it from a negative emotional response to a positive one. As I said, it's vital during that process that a fear response is not caused by exposure to the trigger. And this might be where medication comes in. If we're in a situation where the owner is completely unable to avoid exposure to the thing. So, for example, clients that live near an army base where they're constantly doing army training and the gunshots are going off all the time in a dog that's noise phobic, for example. in an ideal world, the first thing we'd put in is try and avoid exposure. If we really can't do that, then we're probably going to need medication to assist in desensitization and counter-conditioning program. Okay, so the first of, how are we doing for time? Perfect, halfway through. So the first of our case studies is a separation-related case. So this dog, Archie, was referred to me as a 2-year-old entire male Springer Spaniel. Through my history taking, I discovered that he was rehomed from the breeder at 6 weeks of age, which is obviously not legal in the UK. And the main presenting problem was that he was struggling when he was left home alone. He was destroying the carpet around the front door. I've got a video of this for you in a moment. A little bit of vocalizing, but the main problem was he was destroying the carpet around the front door where the owner departed from. And because of that, they'd penned off the area around the front door that he'd already destroyed, but inevitably he was just backing up the hallway and up the stairs and trashing more and more of it. Now, the owner's work routine was that they were generally home. He was very rarely left home alone. And when I was there, it was very clear that Archie was completely unable to settle even when the owners were home. His dependent behaviour was heavily encouraged. So the only place he had to sleep was on the sofa with the owner. And he would only do that if the owner was sitting on the sofa. And after a long period of time of him being very active and unable to settle, he would eventually crash on the sofa on top of the owner, and they would encourage that and have lots of cuddles with him. When he was left home alone, they also confined him to the hallway. And I think that was before, I think that was how they intended it to be even before the destruction. Obviously, then we're in this cyclical issue where they don't want to expose him to any more of the house because he's already trashing the hallway. Archie was a very generally anxious disposition. He was also very fearful of loud noises and traffic. So walks, he was walked, he had an appropriate amount of exercise, he was walked twice a day, but he struggled with his walks. From the house, they lived in quite a quiet suburban area, but still every time a car went past, he would try and sort of pull to the side to the walls with his tail down and cowering, and they weren't able to drive him to every single walk. So he was exposed most days to his sink was filling every single day just from his walks. So I think I've got a video here. Hopefully it doesn't matter if you can't hear, I will put my volume up, but it's mainly just watching what he's doing. Sussing out here, something's going on. So with all my separation cases, I always ask for some baseline footage so we can see what the dog's doing. If the dog, so they left him with some chews there, so he's getting busy with his chews. If the dog isn't normally left alone, I wouldn't say purposefully leave him alone to get this length of footage, but as they were, whenever they were at work, this is the situation he was in anyway. I said, could you just pop the iPad up and a bit of whining there. So you can see the other side of that pen, the carpet that he's destroyed there, and some on the wall. In fact, there's some destruction there by the front door on the wallpaper. Bit of stopping and listening. Now he's found another section that he can unfortunately rip at. Okay, you get the idea with that one. Okay, so when we get presented with a case, the owner says, when my dog is left home alone, it destroys things, or it vocalizes, or it's toileting where otherwise it's a fully toilet trained dog. Those are the three most common symptoms. The first thing we need to question is, are those things only happening when the dog is left home alone? So is it a toilet training problem, or is it that it's losing control of its bowels when it's left home alone, or is toileting very specifically because it's been left home alone? Is it, would it generally be destructive if you weren't there to keep telling it off when it's trying to raid the bin or, you know, shred its bed? But as soon as the owner's not there, it's almost going, yippee, I can fill my boots with trashing, fishing things out the bin and trashing the joint. So we need to first of all determine, is this actually a separation related behaviour? Now, as behaviourists, we don't tend to use the term, we don't label everything as separation anxiety anymore. And I've used this case for that reason, because there's lots of different causes or diagnosis for dogs that are showing signs of struggling when being left home alone. The first thing we want to do in terms of first aid advice is basically say, we really need to not leave the dog home alone rehearsing these behaviours, whilst we get you referred to a behaviourist and get on top of why the dog's doing this and what we can do to help it. Because every time Archie is left home alone destroying the carpet, that rehearsal is making the behaviour stronger. It's not going to fix on its own. Video footage, as I said, is always essential to determine the underlying motivations. So from the owner describing to me, you know, the hall carpet gets ripped very precisely around the front door where the owner's left, and the scratching of the wallpaper as well, that I would be suspicious of one motivation. But having seen the video footage, it actually was very clear to me that it was different motivations than what I might initially think of. For dogs that are also stressed when left home alone, they might pace a lot. They might not be able to eat anything that's left for them. They might excessively drool. Some dogs will go to extent of self-harming through chewing at themselves, biting at themselves, or just general inability to settle. So the treatment advice depends on what the diagnosis is. So is it fear of being left home alone because there was a burglary once and the dog now is scared of being left home alone? Or the dog is scared of being left home alone because they were left home alone and a load of fireworks went off and they were already firework phobic, and now they think being left home alone could lead to fireworks going off? Is it that they are hyper attached to one individual in the home and they can't cope with the company of anyone if that person leaves them? Is it fear of missing out, FOMO? Is it simply that the dog, you know, was a bit gutted that the owner left the house without them? They're used to leaving the house without them. And they're a bit frustrated that they've been left home alone, where it's pretty boring, let's be honest. Is it boredom and they're opportunistically raiding the bin because they are bored and they're not getting enough stimulation when the owner's home, so they're not just resting and sleeping when the owner's not home? Is it vocalizing because of territorial behaviour? So the dog, when the owner's out, it spends all its time sitting in the window watching for the owner to come home. But whilst it's there, it also has great fun at barking and shouting at every person or dog or car that drives past or walks past the house. And the dog's, again, getting hugely reinforced. That barking is scaring all these things away from their home. So we really need to pick apart what the owner's telling us or watch some video footage to really determine what's causing the behaviour. So when it comes to Archie, the first thing we needed to look at was reducing trigger stacking in general and the concurrent stress that was going on in his life. So the noise sensitivities and the traffic and the walks. We need to make sure that his basic needs were fulfilled. So going back to that slide about reducing general stress levels and making sure that all of his needs are met. We needed to increase his ability to settle with the owner present, first of all. If he can't do it with the owner home, there's no way he was going to be able to do it when the owner left the house. So I'm a big fan of providing lots and lots of different bed options for dogs. I don't think you can ever have too many beds. Sometimes they like to stretch out on cool floor. Sometimes they like to curl up and snug in a bed. Sometimes they like to be off the floor on a raised bed. Sometimes they like beds with sides that they can really lean in against. So the more variety we can provide and comfy options, the better. So we did some settle training with Archie just to get him to associate that new beds were for him to lie on, and that he got heavily reinforced for settling on them and lying on them, initially right by the owner's feet. And this was partly also for the owner's sake as well, because there was obviously a bit of an over-attachment in both directions, but probably in this case more so from the owner to the dog, if I'm honest. And we gradually moved the bed away in the lounge so that in the evening he was able to settle on his own in his own bed. We introduced barriers when the owner was home. So we put a baby gate up on, I can't remember if it was the kitchen door or the lounge door, but basically we just reduced barrier frustration in him. It became the norm for the owner to pop out, put the kettle on, come back, wait for the kettle to boil, pop back out, make the cup of tea, come back. So he was getting used to having barriers when he was home, because they never shut doors or didn't have a gate. He was allowed, he slept with the owner, he was allowed wherever in the home. So as soon as he was left home alone and these barriers were up, it could have induced some frustration. Whilst the frustration wasn't directed at the internal barriers, he suddenly had less freedom. From watching the video footage, I think he was frustrated and probably a little bit worried about being left home alone. He, I think, used destruction as a coping strategy that then felt good. If you watch that video footage again, you will see that initially he was a bit whiny and his body language was a bit frantic, but actually once he got the carpet up and he started to really shred and chew at it, his body language changed, his tail became relaxed, and I think that chewing behaviour, as we've described, was releasing endorphins and making him feel better. So we provided him with a lot more variety of items to chew on, again, both when the owner was home, and these were just left out as well when the owner was not home. And we gave him more freedom. We used the gate to gate off areas that like in the kitchen, the owner didn't want him in there just for safety reasons with electrics and things, but he had access to the lounge. We used the video footage with them just popping out the house and round the corner. They were watching him live actually at this point, and they were just using it for their confidence again, to determine what he did when he was left home alone. For separation cases in general, I'm aiming for some form of relaxation. Initially with these dogs, they're not going to sleep when the owner's home alone, but I'm aiming for them to just be able to settle, ideally in their own bed. It doesn't matter if he uses the sofa or whatever, but they're aiming for relaxation. And I'm not aiming to provide them with activities to keep them stimulated, like Kongs or food dispensing toys. I want the dog to associate when the owner goes out, it's time for me to just get some rest. And again, initially they might have their head raised, they might be listening out. If we build up departures gradually, and we're not doing it linearly, we're not doing it incrementally, we're doing it a little bit at a time. So we're doing an easy separation, as long as the dog stays relaxed when we're watching them, and then we might gradually build the length of time, but we'll still throw in some nice easy periods of separation. The dog over time should start to rest their chin, they should start to shut their eyes, and we gradually build in that association that being left home alone is time to relax. Moving on to Barney now. So Barney was a Romanian rescue, around 5-year-old male neutered crossbreed Romanian dog. He was rehomed as an only dog to an inexperienced home dog. They'd not had dogs before. And he was barking and lunging when he saw other dogs on walks. And the equipment he was currently walked in was a harness that tightened. So the lead attached to the back, and if he pulled into it, it was kind of rope material and it tightened as he pulled. Consequently, he walked quite nicely on it because it obviously didn't feel nice when it tightened. There was a palaver about having it put on. He would used to run away and hide and try and hide and sit in the corner and then kind of not very happily have it put on him. Through my questioning, it was evident that he was what we call hypervigilant on walks. So he wasn't able to sniff and investigate his environment and mooch on walks. He was always head up, alert, looking from side to side, checking what's around the next corner. And at the sight of any person, certainly he would be checking, is there a dog with them? And then on sight of any dog, literally on the horizon, he would be barking and lunging towards them. So reactivity towards other dogs is a really common problem. And again, some of the first aid advice we need to be giving is, do we need to keep this dog on a lead, or at least use a long line instead of letting the dog off the lead? Is it an issue when he's off the lead? You know, he's got no recall, he's charging up to other dogs and potentially behaving dangerously to other dogs. Do we need to advise owners to just give their dog space, to turn and move away, to cross the road? Again, a little bit of avoidance at the moment, because every time that dog rehearses lunging and barking towards another dog, rehearsal is making the behaviour stronger. Do we need to advise that the owner muzzle trains their dog for walks? Again, if there is a risk either towards another off-lead dog running up to them, or owners, if there is a scuffle and hands get put in the middle to separate dogs and there's a redirected or inadvertent bite to a human, that is still a lawsuit waiting to happen. So do we need to muzzle train the dog? What equipment is the owner using to walk the dog in? Is the dog comfortable? That's really important. What lead length are they using? It's very typical when you've got a reactive dog or a dog that pulls on the lead for owners to use shorter and shorter leads, whereas actually a 2-meter lead is generally my recommendation. They obviously need some advice on lead handling skills alongside that, but reducing the length of the lead is simply going to make the dog feel more trapped and more frustrated that they can't move freely. What's the effect on this dog of restriction and restraint from a lead or from a harness or from hitting the end of a line? What's the difference if the dog has more freedom? So the first step with reactivity to other dogs is working on relaxation, both before we've even left the house. So either if we've got a dog like this one that's running and hiding when it sees the harness, its sink is already half full. So we need to work on exposure to the harness and getting a harness on a dog without having to manhandle them or even invade their space. And then we need to work, or you might have a dog that goes berserk when you say walkies and its cold tap is already up, filled the sink up here before you've even stepped outside. So we're working on calmness before we've even left the house, and then we're going to work on calmness outside when there are no triggers present, so when there's no dogs around. So for this dog, we needed to work on loose lead walking in a comfortable harness that didn't tighten, because that's also going to be a sink filler, a tightening harness that's not very comfortable. And we're going to work on encouraging him to sniff and interact with his environment, because that's a plug pulling activity. We need to make sure he feels safe. In this case, I don't think it was an issue with safety. And we need to determine, is this dog reacting because it's frustrated that it is stuck on a lead and it wants to go and approach every dog? Or is it that it's fearful and it's shouting at dogs, don't come anywhere near me, I don't want you near me? Or is it sometimes a mixture of both? And in this situation, it was very much a frustrated dog. So he'd come from a no-kill shelter in Romania, group housed, very sociable, then come into a home living on his own. And it's one of my bugbears that Romanian rescues are housed on their own, because they really shouldn't be. And didn't have any doggy threat, you know, had just been taken straight outside on day 2 of this massive trip over to the UK, taken outside on day 2. So its sink was, again, not had a chance to drain before taking it outside, and reactive from day 1, as the owners labelled it. And what happens then is the owners, again, use a shorter lead or hold it shorter and try and get more control, physical control, by holding firmer on the lead, and the dog feels even more restraint and the frustration builds. So actually with this dog, once we let him, we had him on a long line, and we introduced him to one of my dogs through a fence, so that I could really determine exactly what his behaviour was when he didn't feel any tension. So the line was nice and loose, and he just came up and sniffed through the fence and had a bit of a tail wag and moved on, and that was that. So we just had to build his circle, really, build his circle of introducing him to new dogs so that he wasn't rehearsing this behaviour, work on the owner's lead handling skills as well so that they weren't increasing the tension. And we worked on teaching him that when a dog appeared, good stuff came from the owner. You can sometimes teach an alternative behaviour. I think that's another step that's often tricky. So I just work on forming an association that when a dog appears, good stuff comes from the owner, and sometimes he gets to go and greet that dog, and sometimes he gets to walk past that dog and he doesn't get to greet it, because that's life, isn't it, when you're walking your dog? Sometimes they get to say hello to others and other times they don't. And he just needed to learn that rule. For these dogs, they generally have a 1 in 3 rule. So 1 in 3 dogs will walk past and you won't get to say hello to. 1 in 3 dogs, you'll have a quick sniff and then we'll move on. And 1 in 3 dogs, you might linger and you might even get to play with them. But if we just reduce that expectation from the dog's point of view that they don't get to play with every dog they meet, but equally, we're not starving them of any social contact and building that frustration. So initially, these dogs are not suitable for classes or group training. They need to be assessed and we need to determine exactly what's going on with them. But eventually, this dog did move on into a group training class and has done amazing. Okay, moving on to cats very quickly. Briefly, a bit about cats and their ethology and their background. So domestic cats, all of our domestic cats, including the pedigrees, have all got a common ancestor, and that is the African wildcat that is alive and well today, which makes it super for studying and figuring out our cat's ancestry. So these African wildcats are solitary creatures. They are hunters. They are extremely territorial. They mark their territory through scratching marks, through urine and through feces, and through bunting with their faces. They eat, drink, scratch, sleep in lots of different places around their territory, in separate areas and well-distributed areas. They are designed to avoid conflict. They're in fact designed to avoid contact with other African wildcats. So they use lots of marking behaviours to prevent having to come face to face as much as possible. They are both a prey species and a predator species. As I said, they use lots of scent communication, and they've got sebaceous glands located throughout their body, which deposit those scents, pheromones, I should say. So in multi-cat households, cats are part of the same social group if they wash each other, if they sleep in physical contact. So I'm talking literally like croissants wrapped up, so not like this photo here. Owners will see this as cats sleeping together. They're not sleeping together, they're just near each other. If they are physically wrapped up in each other, that is a sign they're part of the same social group. And if they greet each other with nose sniffs or facial rubs, or their tails entwine as they walk past each other. And if they're not doing those things, they are at best tolerating each other, which is fine. In a multi-cat household, if we can't force cats to bond and be part of the same social group. But what we do want, if they're not part of the same social group, is for them to coexist amicably. In owners, unfortunately, body language that indicates they might be stressed is often missed, leading to chronic stress. So in multi-cat households, there can be lots of staring and direct eye contact that isn't noticed by the owners, lots of blocking. So one cat might sit at the top of the stairs to stop the other cat from being able to go past and down the stairs. Lots of avoidance. So one cat might just choose to not go near the other cat, but that's quite hard to spot. And you might have one cat that uses hiding up high or in hiding places, but the owner just thinks that's normal cat behaviour, which it is, but equally we need to make sure that they're not hiding excessively or from something in particular. Cats, domestic cats, unlike the African wildcat, they can be sociable. As we said, they can be part of the same social group, but they are not obligate social creatures. So they don't need to live in company of another cat for their emotional welfare. And that means they don't need to repair their bond after using aggression. So once conflict has developed, either when we're introducing a cat or a kitten in the first place, or during reintroductions, in particular after one cat has been to the vets and we're bringing them home, or to a cattery and we're bringing one home, it can be very difficult to go back if there's an issue between them when we're introducing them or reintroducing them. And the general rule for cats in multi-cat households is that for every resource, so food, water, litter trays, scratching places, sleeping places, there should be one of everything plus one extra, and that these should all be in separate areas and well dispersed. So for example, if I had 3 litter trays, these are my cats, by the way, if I had 3 litter trays all next to each other, 3 in a row in one area, that's not separate litter trays. So the cats would see that as one large, massive litter tray. So we need to make sure that the 3 litter trays are in separate places and well distributed around the house, and that they are also not near other resources. So the cats don't really want to eat or drink near their litter trays, and they don't really want to eat or drink near each other either, because African wild cats would not take their kill to a water source in case there's a risk of the water source getting manky from a manky mouse that they've caught, for example. So they tend to eat and drink in separate areas also. So making sure that everything is kept separate. I'm well aware that that involves a lot of space, and that can be a challenge in multi-cat households where space is an issue. And again, what we tend to do is make sure we make the use of 3-dimensional space. That is how cats see their world. They see the world as 3-dimensional. We tend to see it as very 2-dimensional and the floor space. So with cats, if the space in the house is an issue, we need to make sure we make the most of 3-dimensional space. Okay, so let's talk about Altair, 4-year-old ragdoll neutered male cat who was an only cat in the household. He was urinating and defecating on the spare room bed. This was less likely to happen if the duvet wasn't on the bed. He had 2 litter trays upstairs to toilet in, separate areas, and he did toilet in them quite happily. He used one for his urine and one for his feces. There was a dog in the house that lived downstairs, and there was a baby gate at the bottom of the stairs, and Altair tended to live upstairs. He might try and venture downstairs at times. He would sit on the stairs and check where the dog is, and if the dog was in her crate, then he would come and spend some time downstairs with the owners. If the dog was around, he definitely wouldn't. So he definitely wasn't confident with this dog. So when we get a cat coming to us that's toileting somewhere in the home that it shouldn't be, we need to, again, find out a little bit more information. So we need to determine, is the cat spraying or depositing urine? Is it on vertical surfaces, on the walls, on the doors, on plugs, sockets? That's very common. Or is it pools on the floor or pools on a bed or furniture? What are the locations of that urine? So if it's spraying and it's around external doorways or windows, that's often a sign that the cat perceives an external threat outside. So it may be to do with neighbourhood cats. If it's a multi-cat household and the cat is spraying around internal doorways, then that is often a sign that there's an internal conflict or stressor causing the cat to want to mark in their core territory. So the locations are super important. Is it a aversion to the litter tray? So if it's a depositing issue, is it a litter tray aversion? There's something wrong with the litter tray. Either it's the sides are too high and the cat's quite arthritic and struggling to step into it. Is it that the litter is not comfy on the cat's feet? Is it that it's a closed litter tray and it's not cleaned very often, so it stinks when the cat goes in there? Or is it in a multi-cat household that the cat gets blocked once it's gone into the tray and it can't get out again, so it's now stopping using the tray at all? These are just a whole mixture of reasons. There might be more. Can we figure out what the initiating factor was? So this cat, in Altair's case, he didn't do this for, he's 4 years old and this has been going on for, I think, about 6 months. So we had to find out what happened 6 months ago. And in this case, what happened was the owners had some friends round who hadn't stayed before, and they came to stay the night. They chucked their clothes and their bags on the spare bed and went out for the evening, and he went up and peed on their stuff on the bed. And through questioning, it transpired that these friends own cats themselves. So their clothes and their bags would have been impregnated with a foreign cat scent. So that was, to me, the initiating factor. And then we needed to figure out what was maintaining the behaviour. Why did he carry on using the spare bed, and particularly when the duvet was down? I'll come back to that in a second, because we just need to make sure we're ticking all the other boxes as well when we're talking about undesirable toileting. So multi-cat households, we've talked about, if they're not bonded, if they're not part of the same social group, we need to be careful that there isn't tension or conflict between them by making sure the resources are plentiful, separated, and well distributed. Otherwise, there is a chance that we are causing stress that's going to lead to a stress-related toileting issue. So if we're bringing cats together for feeding time, for example, that aren't part of the same social group, that can create tension. I would always question the owners about the neighbourhood cats. How much time, A, can any neighbourhood cats come into your house? Do they ever come into your house? Because that's a big no-no. B, how much are they in the garden? How much is your cat sitting at windows and watching neighbourhood cats in the garden, and how do they respond to that? And I should also have reiterated that when there's ever an undesirable toileting case, we always need to rule out medical causes for that. And again, that will be a cyclical issue as well, because stress leads to UTIs. That increases, the pain of that increases stress, and we end up with this horrible cyclical situation. And we also need to question to the owners, what is their cleaning regime when the cat is toileting in places they shouldn't be? We need to do our very best to use enzymatic cleaner to get rid of the smell from the cat's perspective. And in terms of litter trays, I've got a photo here of my cat. I caught her toileting in our garden. She dug a massive crater to have a wee, and then she covered it all up. And to me, that sums up how deep we need our litter in our litter trays, ideally, for our cats to be quite happy using that substrate and being able to fulfill their scratching behaviours before and afterwards. So going back to Altair, I determined what the initiating factor was, and contributing factors, so hot tap turning on factors, were the dog in the household, the fact that he felt quite trapped upstairs. He obviously wanted to come downstairs and spent time with his owners. He showed a lot of conflict behaviours around wanting to come downstairs, but the dog being there and not being able to, or even that anxiety when he was coming downstairs, is the dog around or not today? So we needed to work on the dog. We needed to work on visitors coming round, and particularly those that might smell of other cats. We needed to work on his litter trays, because I think that whilst the initiating factor was cat scent on the bed, I think he then thought, this feels really nice. This substrate under my feet feels really nice to toilet on, even nicer when there's a duvet to scratch a bit up. So we did some litter box trials. So I got the owners to do, over several weeks, we did an experiment to see really what his preference was between covered and uncovered, between different substrates in the trays. Location I didn't move, actually, because they were in two. I think the locations were fine, but in each location we had two trays next to each other for the trials. So we had a covered and an uncovered in both locations, and then we switched to two different substrates until we figured out what his preference was. And we allowed access to the spare room without the duvet all the time. The owners had started shutting access off, but we took the duvet up and we allowed access all the time. We changed his time energy budgets with some toy feeders. So instead of him having his timed feeder going off 5 times a day that he'd help himself to, we got him working for his food a little bit more. So I think there was an element of boredom with him being stuck upstairs as well and not being able to come down. And we worked on the dog's behaviour around him. So the dog was on a lead whenever he then was looking like he wanted to come downstairs, and just building his confidence with coming down. And the dog, to be fair, the dog didn't do too much. She wasn't awful, but she just needed to learn to just completely ignore him. It was a very clever working cocker, so that was quite easy to teach her. And then the second cat case I've got is an aggression to the owner's situation. So Poppy was a 6-year-old female neutered domestic short hair tortoiseshell. She was a solo cat in the house. There was no other animals in the house. And she was referred to me because of sudden onset of aggression to the owners at complete random. So they hadn't worked out what any triggers were. And again, whenever there's a sudden change in an animal's behaviour, it's really important that we rule out or investigate potential physical causes for that, because 9 times out of 10, when there's a sudden onset, it's often an internal cause. However, in this instance, it wasn't. So when this had happened a couple of times, the owners responded by shouting. It hurt. One of them was hospitalised, in fact, by how severe the bites were up her arm. And so emotions were high. They would shout, they would scruff her, they would chuck her out of the room. And you know, it was a whole hoo-ha, understandably. And the cat had a recent bout of feline idiopathic cystitis. So again, I needed to find out what potential initiating factors were. What were the triggers that caused this? And it was apparent that a new neighbourhood cat had moved into the area, a very bold male cat that was coming into her garden, and Poppy was spending less time out in the garden. She used to enjoy time outside, and now she was spending less time out there and was sitting at windows watching. And it was likely that it was the appearance of this cat coming into the garden that caused her to launch at the owner in what we would label as a redirected aggression response. So she can't, or she's not confident to run out the cat flap and see this cat away. So she sits and watches it through the window and redirected onto her owners. So we knew what the trigger was. What are we going to do to stop this from happening again? And to reduce her stress in general now, because it's obviously become very stressful for her and everyone living with her. You know, that unpredictability of when the cat might come in the garden and she might launch at the owner doesn't make it any better to live with. So we explained to the owners why purposeful punishment would not be advocated in this situation. I get that's very different to a reaction when you've been badly hurt and shocked yourself, but purposeful punishment in the name of trying to train her out of this behaviour was going to exacerbate her stress, which will exacerbate the whole situation. So we needed to really also look at making the environment as feline friendly as possible. And where she used to enjoy going outside to go to the toilet and to hunt, she now was being forced to go into an environment that she felt quite vulnerable into, to go to the toilet, and she wasn't spending any time hunting. So the first thing we needed to do was bring some litter trays into the house for her, so she had all her needs met in her core environment. So she didn't need to go outside for any reason. We then screened off the windows at the back of the house. So we put temporary opaque frosting on the bottom third of the windows at the back of the house. And that was for two reasons. One, so that she felt safer in her home and she didn't feel like this cat could look into her core territory, but also to just break the habit of her sitting on watch, feeling anxious, looking out all the time for this cat. We made sure the cat flap was already a microchip cat flap, so we made sure that this cat was never going to have the opportunity to come into the home. That obviously has implications in the summer, but you know, sometimes we need to put screens on doors or windows so that we can let fresh air in, but neighbourhood cats can't come into the core territory. We increased her play opportunities at home so that she had outlets for hunting / play behaviour. We also altered her time-energy balance and made her work for her food as well, because she was spending less time outside. We needed to make sure that her home inside was enriched. We also discussed liaising with the owner, finding out the owner of this new cat and discussing kind of a timeshare situation. We also discussed cat-proofing the whole garden so that she could spend time in the garden a bit safer. The problem with that is generally the cat-proofing of the gardens will stop the resident cat being able to get out, but it doesn't necessarily stop neighbourhood cats getting in. And once they're in, they're then stuck in the garden as well. But yeah, so we discussed those, but we decided to just get started with changing all of these things. And pleased to report, this was a while ago now, there's been no further redirected aggression. So what's the difference between, particularly for dogs, what's the difference between recommending a dog trainer or a behaviourist? There is obviously an overlap. So I always say that every trainer needs to have really good awareness of an animal's emotional state, and equally all behaviourists need to be able to train a dog. So there is an overlap. There's also an overlap because the training methods that we use will alter how an animal feels. So if we're using unpleasant consequences, the animal is going to be in a more negative emotional state. And when an animal is in a negative emotional state, when they're feeling stressed or anxious, they will struggle to learn new behaviours that we're wanting them to learn. And the emotional state becomes attached to the cue as well. So if we're teaching a cue, if we're teaching a dog to sit and we say the word and then we push very hard on the dog's bottom and force them to sit and then release that pressure as soon as they sit, the dog is going to hear the word sit and not feel that great about hearing it. Whereas if we say to the dog sit, hold a treat in our hand and raise it so that as the dog follows the treat with its nose or its mouth or its eyes, and its bottom naturally hits the floor, and then we feed the treat, they're going to start hearing the word sit and think, oh, great, I know what might come. So how we train is going to affect their emotional welfare. And yes, so the other thing I was just going to say is that a trainer will generally teach an animal to respond to cues, whereas a behaviourist will get to the bottom of why an animal is showing unwanted behaviours, what emotions are causing that behaviour, and how can we change those associations or those motivations in the first place that will then cause the behaviour to change. A quick note on neutering. I know I've gone over. Always do, sorry. A quick note on neutering. For male dogs, I would be questioning, is testosterone impacting the behaviour in a negative way? So is the dog really struggling to cope with frustration? If the dog is fearful or anxious, castration would not be recommended at this stage until they've worked through with a behaviourist, because testosterone is a confidence-giving hormone, and if we take away what confidence they do have, we can often exacerbate the problem. In bitches, all I would say is that it will depend on how, if the dog is particularly fearful in the vet practice, again, I would want to do some work on building that relationship and confidence coming into the vets and having things done before taking them away to spay them. And it's more about the timing of the spay in bitches. So we want to spay them as close to the next season as any vet is willing to go. That is to make sure that their prolactin levels are as low as possible, because when a dog is spayed and their prolactin levels are high, so that's most common when they're having a phantom pregnancy. We definitely never want to spay a dog during a phantom pregnancy. Their prolactin levels can kind of get stuck in that level, and that can lead to persistent phantom pregnancy. And one of the signs of that is not always behavioural signs such as nesting or physical signs, but one of the signs can just be an increase in anxiety or aggression in bitches. So one of our differentials in bitches that show increased anxiety or aggression at any time is, when did it start, in particular in relation to this dog's spay. And that's, I'm sorry I've gone over, I always do, but hopefully there's time for questions. If you have had to rush off or you're watching this as a recording, feel free to email me any questions. My email address is here.
Awesome. Thank you, Rosie. That was fab, really practical. Got us lots of really, really nice tips there for going forward. So we do have a couple of questions already in. If anyone else has questions, like Rosie says, just find that Q&A button at the bottom and you can pop in a question. So the first one we've got here is from Claire at Dalblair Vets, and she's asked if you recommend a particular make of muzzle.
Well, I generally always recommend basket style muzzles, because the dog can pant whilst wearing them, and when they're stressed, then they need to pant, as we've already discussed. So the Baskerville ones are fine, particularly for coming into the vets. I would say the Baskerville ones, either the Baskerville cream beige ones or the ultra ones, which are black, are fine for that. For dogs that need to wear them longer term, like on walks or, you know, for a longer period of time, there is a new-ish brand of muzzle. I'm just looking it up now on my phone because I've forgotten the actual name of it. Bear with me 2 seconds. The muzzle movement is one that I would recommend looking into. So they're really spacious, big, but lightweight muzzles. The dogs barely realise they're wearing them. They're much easier to train them into wearing, but they are quite pricey. So for things, you know, for short-term things, we just want the dog to be able to pant, to be able to feed treats through the bars, smear something on the inside of the muzzle, all of that stuff. Make sure we can do all of those.
Cool. Awesome. Thank you very much. So next question we've got here is from James. Would you recommend using any drug or supplement during behavioural adjustment work?
Yeah, I mean, it depends on the case. I would say that there are very few reasons not to recommend supplements of whatever type. The only reason not to is financials. So sometimes owners feel like they've already spent a lot of money on these and they haven't been the magic wand, you know, silver bullet that they were hoping it would be, and then they sort of are reluctant to spend money on actually getting a behaviourist and you know, things that actually more practical things that might work. So that's the only reason not to. But yeah, certainly in terms of drugs, I don't know if you're getting a sort of psychoactive medication. Again, I would want a really clear diagnosis from a clinical behaviourist or veterinary behaviourist. I think most of them that are licensed for use alongside behaviour modification as well. So we shouldn't really be, prescribing psychoactive medication without them then also getting referred for some help. They should always be kind of hand in hand. The same with the supplements, really. They're never going to fix the problem, solve anything on its own, but everything should be alongside, trying to reduce and minimize the animal's stress levels, for example.
Yeah. I think that's the idea we're coming at with the Serenacare. It's trying to get them in a good place to learn, and so they're actually receptive to learning and improving their behaviour, as opposed to, like you say, magic bulleting it. For sure. Awesome, thank you. So we've got a couple of comments here from Sarah. She said they're currently spaying 18 to 22 weeks from beginning of the last season, but they have a vet check on admission as well. Does that sound okay?
Yeah, so I think I'm not a vet, so I need to be a little bit careful how much detail I go into here. But if you type into Google, oh gosh, let me think of her surname, Sarah Davies, veterinary behaviourist, phantom pregnancy, you will find a couple of really good articles from her in a veterinary publication that go into this in a bit more detail. But her general advice is, as I said, as close to the next season as the vet is willing to go, generally around 4 months from the start of the season.
Okay,
but
perfect.
Definitely all cases need a really good squeeze of the teats before admitting for spay, absolutely, and a questioning to the owner of any kind of behavioural signs at home, and make sure that there are absolutely no signs of phantom pregnancy before admitting that bitch. Absolutely, that's brilliant that you do that.
Awesome. So just got 2 more coming up. We'll just go through these. So from Charmaine, what or how do you recommend for cats and dogs to be introduced?
Okay, so yeah, this is a really important question. We need to make sure that from the get-go, the dog never has the chance to chase the cat or scare the cat even, because from the cat's point of view, there's a predator in the home. And we need to make sure that the cat feels safe in its home and isn't feeling like there's a predator in my home and I no longer feel safe. So we need to make most of barriers. So that's where gates will come in, leads on the dog, and really, really tight management during that introductory process. And it might take a while. They might need separate areas. We might need to relocate some of the cat's resources so it doesn't have to run a gauntlet through the dog's area to get to its food or his litter trays or the outdoor access, for example. So it might need a bit of replanning of the house. It might need thinking about where the dog base might be for the cat to be able to pass. And lots of training of the dog that the cat's boring. Doing anything other than looking at the cat or thinking about the cat or focusing on the cat gets heavily reinforced. So yeah, lots and lots of that, making sure the cat's got high places to navigate around the home so it doesn't have to run the gauntlet on the floor, lots of things like that.
Perfect. Sounds great. And just the last one from Stephanie Ray. What is your opinion on the use of pheromones such as Adaptil or Feliway, etc.?
Yeah, I'm a big fan of the pheromones. I think they can be a really good, another supportive tool for both cats and dogs. And the nice thing is in a multi-animal household, multi-species household, you can run both. Feliway doesn't impact dogs and Adaptil doesn't impact cats, so you can run both to help. So yeah, definitely a big fan. Again, it's often just a cost thing of making sure the owners are aware it's unlikely to be a magic fix on its own, but it's a supportive tool.
And we just got one more that just sneaked in there that I'm sure we've got a second for. So Lauren has said, you mentioned that you introduced a dog-reactive dog to another dog through a fence. I have previously been told not to do this due to barrier frustration. Can you explain a bit further, please?
Yeah, so again, it depends on the dog and the history taking. And in this situation, I was so sure that he was a very frustrated doggy that he wasn't muzzle trained. So you need to have a barrier for safety, right? When we're doing, I'm not putting my dogs in any situation where there's a risk of a dog that we don't actually know for sure how it's going to react. I had my gut feeling that it was frustrated and he was going to be fine up close, but I wasn't prepared to put my dog straight into the lion's den. So he would either need to be muzzled or through a fence. And even muzzled, you know, if he wanted to pin my dog down, then that's still not good for my dog. So the way I do an introduction through a fence, it takes probably 20 minutes of the session to build up to being close through the fence. So we work, as I said, we already worked on this dog learning to be calmer when there was nothing around, and then he would gradually see my dog at a distance, and we gradually move nearer, and we'd work parallel walking, so we never just head straight to the fence like this where there's more likely to be an interaction. We do parallel walking, and then gradually this dog would sort of follow my dog. It's very controlled, so my dog is kept looking forward. He doesn't, at this point, he doesn't turn around to make eye contact with the other dog. So it's all very controlled, and yeah, there is a risk of barrier frustration, but if it's done properly, I can't remember the last time I induced barrier frustration with the fence through doing it that way.
Perfect. No, that's really helpful. Well, thank you very much for the session tonight, Rosie. I'm sure I agree with everyone on this call here. It was fantastic. We got a lot of really useful stuff from it. As Rosie says, any questions at all, you can get in touch with her. You can also get in touch with us here at Protexin. Over the next little while, I'll send out some CPD certificates, and I'll give you a little bit of feedback and the recording from tonight as well. But thank you very much for everyone's time, and I hope you all have a great night. Okay, take care. Bye for now. It was brilliant. Thanks so much. Bye for now. Bye bye.